Should we all be wearing masks?
No.
Why?
Because right now there isn't anything going around in the community, certainly not coronavirus, that is calling for the broad use of masks in the community.
Why do healthcare workers wear masks in the hospital then?
Well, because a healthcare worker who is taking care of someone who was known infected with a transmissible virus, that's different from walking around in the streets wearing a mask.
Are children getting the coronavirus?
To a much lesser extent than adults. And for reasons that are still unclear, it may be that they are getting infected, but their symptoms are so low they're not being recognized. But in a number of reports that have come out from China, there are very few cases less than 15 years old. You'll always find the exception, but most of the cases are a mean age of about 50.
What can we do, or what can our families do to protect ourselves? What's the most effective thing?
Right now, and I think the question you asked about flu is important. Right now, we are still in the flu season. What you can do to protect yourself against the possibility of coronavirus is the kinds of things you would do to protect yourself against flu. Now, obviously, you get a flu shot, you can at least protect yourself against flu. But also things like, we always say it, it sounds simplistic, but it's true, washing of hands, if possible, staying away from people who are coughing and sneezing. If you yourself are infected, stay out of work. Don't send your children to school if they're infected.
My time is up. Senator Murray.